36 years of age. She had breast cancer diagnosed in 22 and then ended up having reconstruction with a tissue expander. And then the question is if Eloderm was used or not. This was interestingly above the muscle. And so she had left breast cancer. She got a prophylactic right side. And now she came in with many complaints, of being hurt and harmed by the implants. So these implants are just 3 years old. So left breast cancer, I started off on the right side, always the opposite side. And so as you will see right here, complete end block, 82825 initials SM. And so the first thing I want to go ahead and show you that there were surgical clips, not uncommon to see what the breast surgeon, the mastectomy doc put in on the lateral side where they do the lymph nodes. So this is the right side that I started off. I saw what were, she had fat grafting done twice. And as I was dissecting, I saw what are clearly these clumps right here, nodules that form. Remember, on a breast cancer patient, or any patient for the matter, any mass of the chest is breast cancer till proven otherwise. So as I touch this right here and I cut this, look at this nodule right here. You will see this nodule right here. It's like the size of a pea. You can see right here. This is very common in fat grafting with necrosis. And you can see you feel a mass and you feel the size of half the size of a pea-sized mass. So anything abnormal, irregular, I basically remove, and if I cut it, you will see this is like a oil cyst, if you will. You can see that. And so believe it or not, if you read, depending on the surgeon's technique, anywhere from 50, 60, 70, even up to 80% of the fat gets absorbed, or clumps of fat, or bad things happen to that fat, and only 20-30% of so 40% may take, and that's being generous. So the fat grafting, not a good idea in my books. What I say, malpractice, because you have all these irregularities that form in and around where they put in order to give it, and some of it will take, some of it will not, and they themselves, she had a very bad irregular contour of the chest. So I basically, so fat grafting, a big no, in my understanding. You do not, 1 out of 8 or 9 women will get breast cancer, so we do not want to complicate especially even in a case like this, because you can have recurrence, right? Someone will argue that she's already had a mastectomy. So you will see the stitches at 12 o'clock, so I know that is lateral. I removed some of the excess fatty tissue on the side for aesthetic controlling what is an aesthetic flat chest closure. So surgical clip, right chest mass, that's going to be sent separate. Right mastectomy is going to be sent separate. And here you have the implant and the capsule done, end block, complete removal. And I'm going to now cut this open, and so we'll see what this shows. So remember, these are relatively very fresh implants. They're just 3 years or so old. So as I cut this open, if you touch some of these areas right here, there are clumps of fat as well. Likely from the fat grafting, and you can see right here, classic use of the Eloderm right here. So indeed, she did have Eloderm. You saw, look at there, small amount of fluid, not enough to send to cytology. So as you will see, some stickiness, and you will see this. Look at the boundary of the Eloderm. You can see that hair follicles. This is cadaveric skin. You can see the corners of this. So if I go, you will see the leaching of the silicone. You can see also how thin this capsular tissue is, no matter how thin or how thick, because it has Eloderm embedded within it. All of this removed, and if I put this on the, I'm just going to go ahead and grab the ruler, you will see, I'm going to use this. You can see how thin this capsule is. You can see my glove as well. And all of the Eloderm, surgical clip, mass, everything removed, and it's going to be sent separately. So I'm going to go ahead and put this here. I'm going to remove my top glove now. It's a sterile glove underneath. I'm going to focus on the left side with my new pair of gloves. This is the surgical clip again that I removed on the side. You will see this is the stitch at 12 o'clock. You see the artificial nipple that she had right here. And you will see full thickness mastectomy. This is the most tenuous area. So you can see very thin. The area that's in the most projected has the most compromised blood supply, if you will. And then as you will see right here, these are masses again. If I touch it, you will see these are irregular nodularities. And you can see right here, all scar tissue, part of what I would say fat necrosis. Remember, we're always thinking breast cancer as well. And so we'll see what the pathologist says. So look at this, like hard like a rock mass. The black part is the bulicautery, if you will. So I'm going to send this right here. Very hard mass, like right here. So just by visualization, palpation, gut instant looking at this, anything abnormal, irregular is removed, as you can see right here as well. The other thing I want to point out is you can see this contracture band, how it's not round. It is literally pulled the implant inward. So as I go in, you're always thinking there might be fluid around as well. So look for any masses, suspicious masses, lymph nodes. If I do run into them as I'm dissecting, I will remove it. So I'm not going to go into the axillary area at all. And so as I go ahead and pull this out, you can see again the leaching of the silicone. This is your 385 allergen, just like the patient stated. You can actually see, look at this band right here, how it was kind of sitting like this. So you can see, even if I straighten it out, how it was quote unquote hurting the implant. Again, you see my green glove underneath, you see the allerderm, cadaveric skin from another patient. And here it is. And so I'm overall very happy with how the whole dissection has gone. So aesthetic flat chest closure on the left as well. Complete entire implant capsule, all inflamed tissue, alloderm removal, mass right and left chest. So anything abnormal is removed. So the implants will be sent home with the patient. Number 2, capsules to be sent to pathology, rule out the rare BIL, CL, CD30 analysis, rule out lymphoma, rule out malignancy. Right and left mastectomy scars to be sent separately, and the right and left chest masses to be sent separately. And so we'll have a lot of data from the pathologist back. Not enough fluid or no fluid to be sent to cytology, and most importantly, we'll see how the patient does post-op minus the implants. So there you have it. NBlock, the gold standard. This is Dr. Khan, Executive Plastic Surgery.